Last week, in a rare move, the US Surgeon General issued a public health advisory, warning of an emerging youth mental health crisis. The alarming 53-page advisory cites a crisis that has been exacerbated by the pandemic. Such advisories are reserved for significant public health challenges that need the nation's immediate awareness and action. It's clear the US Surgeon General was sounding the alarm on student mental health. The Surgeon General's advisory notes that depression and anxiety have doubled, with 25% of youth experiencing depressive symptoms and 20% experiencing anxiety symptoms. Negative emotions or behaviors like impulsivity and irritability are also increasing. While children of all backgrounds are at risk for mental health challenges, the nearly 2 years of disruption from the pandemic took a toll and worsened mental health, especially for groups such as immigrants, students with disability, and students of color from low-income families. Also, many students of all ages and levels are having trouble adjusting as in-person school resumes. While the attention that the Surgeon General brings to this issue is welcome and very necessary, it is unfortunately not new news, especially to parents, teachers, school personnel, mental health professionals, and of course, students who have been warning of and grappling with this growing crisis since the pandemic. I am Amy Braun, President and CEO of HealthCorps, a national not-for-profit focused on closing the health equity gap through student education and empowerment. Since 2003, we have been working in high-needs schools across the nation, supported by school partners like the ones with us today and members of health and wellness professions. Our near-peer teen mentoring program has impacted over 2.5 million students in 23 states, providing them with the tools to take control of their health. Today's panel is part of HealthCorps' commitment to teen mental health. We want to bring awareness to our communities and the public about the crisis our students and schools are facing. During this season of giving and gratitude, we're choosing to give back and share our knowledge, best practices, and experts with the broader community, hoping to impact change and increase support for our kids. With me today to discuss the teen mental health crisis and the steps the collective we must take to address it are several of HealthCorps' most engaged partners. First, I'd like to introduce Carrie Woodard, a national certified school counselor and Propel at Propel schools in Pittsburgh, Pennsylvania. Carrie holds a bachelor's degree in secondary education social studies with a second major in history from Temple University and a master's degree in schools counseling from the University of North Carolina at Charlotte. With experience as a middle school social studies teacher, high school counselor, and college and career counselor, she has invaluable insight into the way students learn and succeed. Currently, Carrie serves as the project manager for Propel Partners in Wellness, the comprehensive wellness support system for Propel schools, a charter school system in the greater Pittsburgh area, and one of HealthCorps' most recent school partners. Welcome, Carrie. As well, we have Dr. Mena Mirhom, a member of HealthCorps' Board of Advisors. He's a board-certified psychiatrist who specializes in the treatment of adults and adolescents. He is also a partner with the National Basketball Players Association Mental Health and Wellness Initiative, which provides mental health treatment to players and staff of the NBA. Welcome, Dr. Mirhom. And last, but definitely not least, we have Dr. Judith Joseph, also a member of the HealthCorps Board of Advisors. She is a board-certified psychiatrist with additional expertise in child and adolescent psychiatry. She treats adults, children, and families in her New York City practice. Dr. Joseph is a clinical assistant professor of child and adolescent psychiatry at NYU Langone Medical Center. Welcome, Dr. Joseph. Now, thank you all so much for being part of this conversation. But to get us started, I would really like to hear from our students about what they think about mental health and how they're feeling.
What's so terrifying about mental health? It's like a fire, like a wildfire. You have no idea where it's going to go, and it just spreads and spreads and spreads. It's so unpredictable.
Almost everyone I know has like a decently high degree of stress.
Like, stress makes me feel that I don't know anything about how I feel or how I want to feel.
I was struggling at home. I mean, I did the work and I tried to understand. I watched videos all night long, but there were nights where I was just like up till 2 a.m. stressed and trying to figure it out.
One of the things that I noticed going back, even I do feel it, it's like there's the aura that like it's like it brings you down. Like you don't feel as happy as you used to.
And at my school there's like a whole lot of fights because they're arguing about the stupidest thing, the last tray of pizza and all that, because we didn't know really how to communicate anymore.
Returning hasn't just been a breeze for me. It's been kind of hard and scary because I have a grandma at home and I'm scared to catch something and bring it back home to her, you know?
And me, personally, I have honestly had a lot of trouble with talking to people more. I used to be like really outgoing, but now I'm more like an introvert.
But just being at home for days on end and you can't go anywhere, it kind of breaks down your soul.
But it's never going to be the same again. Like I don't think it's ever going to be that time when everyone is so carefree, you know, not wearing masks is definitely not going to be a thing anytime soon. We feel more alone now than ever before.
Well, that last sentence, we feel more alone now than ever before. So what we just heard from our kids is what we at HealthCorps have been hearing since being back in school. Our students and staff are burnt out, they're depressed, they're anxious. We're seeing behavior issues, absenteeism, academic regression, reduced engagement in school and social activities. Counselors HealthCorps has spoken to believe outside help is desperately needed. So with that, I would like to turn to our panelists to weigh in. And Carrie, I'll start with you, but really kind of want you to maybe paint the picture for us a little bit about what you're seeing on your campus, like like the comments from the students in the video talked, but does it match what you're seeing, what's happening in your school communities?
Sure. Yeah, those were some really powerful stories. The kids are just so open and honest about what's going on in their young lives. So those stories and comments, they definitely resonate with me and what we're seeing and what we're hearing. Some of the same things at Propel schools. The pandemic, as we know, it's exacerbated existing challenges, and we're all learning how to navigate the world in ways that we never had to before. But our teams have the added stress of balancing life in a pandemic, staying safe and keeping others safe. We heard the young girl talking about her grandma. She lives at home with her grandma, and she's scared of contracting the virus and bringing that home. So I mean, just imagine what that young lady is feeling every day going to school and feeling that she could be exposed at any moment. It's just so stressful. And then some teens have the added stress of people who are near and dear to them who are getting COVID or unfortunately dying from COVID. So they're experiencing a new type of grief. But I do want to mention that grief doesn't necessarily have to be about experiencing death. Grief can also be loss of a relationship or loss of a former life. The young man in the video mentioned that staying home for days on end kind of breaks down your soul. Our kids are experiencing grief and loss in a myriad of ways. And then there's also the anxiousness associated with not knowing what is to come. The world doesn't feel like a safe place right now. And once we're finally feeling like, okay, maybe we're on the up and up of the pandemic and vaccines came out and everyone's getting excited, but then all of a sudden we hear about a new variant, right? It's just very scary. And there's a lot of uncertainty. So we need to be aware of the climate that we're living in right now, and that things are much different for our youth today than they were when, any of us on this call were teenagers. In our high schools, specifically at Propel, our mental health professionals were definitely seeing anxiety spiked in our teens. And some students are struggling with behavior and controlling their emotions, having outbursts, things that might have never happened before the pandemic, and they're seeing that in themselves. And then there's also some teens that are struggling with focusing in class, remaining seated in class, being engaged, following simple directions. One of the young ladies in the video was talking about how she was, really struggling with the social aspect there. So we're definitely seeing that. We're seeing a regression and just being social with one another. So we just need to take note that, for a long time, our kiddos, they were either 100% remote or they were in some kind of hybrid option. Some hybrid option. So the pandemic has really affected that in so many ways. The isolation and the inconsistent schooling is contributing to the problems that we're now seeing.
Yeah, absolutely. I mean, I think you called out some of the great, examples that the students themselves, shared. Dr. Mirhom and Dr. Joseph, before we kind of go into some of the why and the clinical background as to why we're seeing some of these behaviors, and I wanted to give you guys the opportunity to share in your practices, as you both work with adolescents and families and kids, if you've seen kind of some specific interesting examples that really help illuminate what our kids are feeling and doing.
I mean, absolutely. Everything Carrie said is spot on, and we see it, in our offices every day. And I think that it's important if you really put yourself in the shoes of a teen. A lot of teenagers think, okay, I will be happy when I get into college. I'll be happy when I get this. And maybe some of them on some level thought, okay, I'll be happy once I return to school. And then, that expectation didn't pan out because those psychological stressors are very real. And, we don't know a lot about the United States pandemic psychiatry, but we know about other countries. Europe has gone through pandemics. Asia has gone through pandemics. And so what people are feeling is exactly what we predicted would happen. Increased stress, poor sleep, irritability. And for some people, some more vulnerable groups, they're really struggling to kind of re-engage in society. And so it's important to have programs that are focused at looking at the red flags and buoying, these people who are more vulnerable. So I'm sure that Dr. Mirhom has seen similar things in his practice.
I have as well. I definitely agree, Dr. Joseph. And one of the things that really struck me in speaking with the teens is the breadth of loss, right? The huge variation here from some of these things. Of course, losing a parent or a loved one or a caregiver, that's tremendous, right? Of course, being in quarantine, that has a huge impact. But what some of the teens will tell me is, Dr. Mirhom, I didn't get to go to prom and I just never will. That's it. That's over. There are some of these events that I was looking forward to my whole high school experience, and I just won't do them anymore, right? There's a period or two, and some teens will tell me, I feel like there were a couple of years of my social life where I was supposed to hang out with friends. I was supposed to do these normal kid things, and I don't do them. They're gone, right? So kind of seeing, for me, it struck me, and I love, the videos from our teens here, because there's this old adage in medicine that if you listen to the patient, they'll tell you what's wrong with them. And it's all the more true in this situation. If you listen to our teens, they know exactly what's wrong. They know they're feeling grief and loss and trauma, and they are overwhelmed, and they don't have the words for it, but they can describe it. It's actually kind of incredible. So in a very real human way, this is something that we're seeing every day. And like you said in the intro, Amy, nobody after the Surgeon General warning was like, oh my gosh, I had no idea. I thought everything was amazing. But we were struck by the fact that, wow, this really highlights the fact that we are all going through this. So we have to kind of get on it, head on.
It's a different pandemic, right? It's a pandemic
Right.
all its own now that we all need to be prepared to deal with.
Right.
Carrie, you brought up Anjanae and her kind of feelings about, had the choice of going back to school, right? And how this, I have fear and anxiety that I'm going to bring home the disease. And, a piece that we didn't include in the video, which was really impactful, that she did talk about in her interview, was the flip side that Dr. Mirhom is talking about is, but I have to be a kid, right? I want to go see my friends. I want to experience high school, and I want to be on campus, and I want all of those experiences. And this dichotomy of such, I have to go to school. I need to for myself and my own personal, desires and decisions. But oh my God, I have a mother going through cancer and a sick grandmother. And, what if I'm the one who brings it home? I think she just really illustrated just that fear and then anxiety and that pull of like, I want to be normal and I want to be in school. But at the same time, my choices at the age of, 15, 16, 17 have severe, ramifications and consequences. And that's hard and scary. I'd like to just focus a little bit on a little bit of the clinical perspective. So I would love if we could kind of talk about, and, Carrie, you've got a background in counseling as well. And Dr. Mirhom, Dr. Joseph, obviously your clinical expertise, but why are we seeing some of these behaviors with kids? Dr. Mirhom, you touched a little bit on the grief and trauma, but I think it would be really interesting. I've heard there's like immediate effects of grief and trauma, right? And then there's the long-term effects. And I think a lot of what we're talking about on here and what our kids are talking about are the immediate effects. And I would definitely want to kind of explain why that's happening, but also touch on sort of what should we be thinking about, right? Or what are those long-term effects of grief and trauma we haven't seen yet, and maybe what's coming. So Dr. Mirhom, I'll start with you.
Sure. So I think you're putting it really well here, because this is a unique situation for our teens, where we're kind of seeing the mix between immediate, prolonged, and sustained. That initially we were focused on the fact that, well, quarantine is very difficult and we're going through this very difficult time. But this is a unique time for them, where you have this ongoing period for years, and the unpredictability or the uncertainty of, well, this may never end. I don't know if I'll ever have a normal teenage life. I don't know if I'll ever sort of come out of this. So trauma, there's an element of it that sort of by definition is a stressor that overwhelms your defenses, overwhelms your ability to cope with what's around you. And that's exactly what we've seen with our teens here now, is emotionally, socially, psychologically, whatever they were equipped to handle has just been overwhelmed. And this has now been the ubiquitous experience of most teenagers. One of the teenagers in the video just said, I know everybody around me is going through it in one way or another. And sometimes that hits them in a particular way. For example, there's a study that came out that showed that 140,000 children have lost a caregiver, a parent or a grandparent. So when you lose someone, this is a particular kind of grief and trauma, where your loved one who was caring for you has now been removed from you. We're seeing the effects of this practically kind of play out. The fact that one report showed that ER visits for teenage girls has been up 51%. That's an enormous increase in these emergency room visits, showing us that there are, again, just more and more signs that we are in this ongoing crisis, that things that we were usually turning to for support, or a teenager is going through a difficult time at school, well, home can be a solace. If they're going through a tough time at home, well, school can, with my friends, can sort of be a way to escape and to be able to have the camaraderie of my friend group. Well, that's been taken away. So when you combine the different elements of loss and things that have been stripped away as coping mechanisms, then you see, well, this is no longer an outlet, and this is no longer an outlet, and this is no longer an outlet. The teen is just left then to reflect inward and say, well, where do I turn to now? What do I do with all of this? How do I process it? And that's why I think that's one of the reasons that we're seeing the depth of this stress and trauma and loss really taking a toll on our teens in a profound way.
Absolutely. Dr. Joseph, I don't know if there's anything you want to kind of add from your perspective as to a little bit about why we're seeing some of these behaviors in teens.
No, I think that what Dr. Mirhom and Carrie said are absolutely on point. Teenagers need to feel safe, right? And a part of feeling safe is knowing what to expect. And the messaging around COVID was very clear at the beginning. Let people know that this is going to have an end. We know that there'll be a vaccine in sight. And, positive psychology teaches us that if we think, okay, I'm going to be happy when this next thing happens, and we don't work on these inner strengths, right, in the present, then even though the thing we're hoping for happens, we still don't find that happiness. We're not as satisfied. And so, what Dr. Mirhom was pointing to about, the things that you value, like your athletics. And for, adolescents, it's identity. Am I a student athlete? Well, that's not going to work out if the team doesn't get to practice. Then who am I? They have this crisis of identity when the things that are the core things that make their personalities are not available, like their social connectivity, their friend groups, the things that really give them purpose are not present. Then they kind of lose sight of the vision. Then the thing that's coming up in the future isn't as rich or purposeful. And so it's really important, from a positive psychology approach, to work on yourself daily, to have, spaces where you can cultivate your strengths, your values, your purpose, so that even when things don't work out the way you expect, at your core, you'll be okay. And so I think it's important to enrich our youth before a crisis. So prevention is key. There is no vaccine for this mental health epidemic, but prevention is totally key.
That's an interesting idea. So the idea that really so many of our teens, and I think everyone, but particularly our teens, really identify as a component, I guess, of school. Well, maybe I'm the cheerleader or the band member or the straight A student, or right, whatever they kind of call out to themselves. Maybe they're the loner, but again, whichever direction it is, it's some piece that they've wrapped their full identity around. And so when you've removed their ability to kind of engage with that, I guess, and we'll get to in a second, but I'm kind of leaning towards it. I guess what you're left with is social media. And then that creates a very false sense of an identity and sense of self, I guess, correct? All right, I got some head nodding. So with that, actually, it's a perfect, I didn't know we were going to go that direction, but it is perfect kind of leaning into the next question. So I'm sure everyone's heard about it. Dr. Mirhom mentioned the study about a 51% increase in teenage girls' suicide and self-harm. And what a lot of people are leaning to is social media. So the CEO of Instagram was on Capitol Hill last week answering some very tough questions from the Senate subcommittee on consumer protection. Senators grilled the CEO on internal research that was leaked by a whistleblower that showed Instagram had the toxic effect on some teenagers. And 1 out of 3 teenagers in this report felt worse about their body image, and as many as 16% of some teens in the UK had thoughts of suicide. Now, HealthCorps itself does have an Instagram account, which is Teens Make Health Happen, where we work to provide positive messages and images to empower teens. But, it's not just Instagram where this is obviously happening now. Our kids are on TikTok and YouTube. And of course, I just heard about a new one, Discord. So there's all of these new sites popping up. And we actually had the opportunity to speak with our kids and hear a little bit about what social media does to them and their friends. And I'd love to play that now because I think it's quite impactful.
I've been in social media lists for 2 years now, kind of feeling out of the loop.
Social media during the pandemic became the primary form of communication.
And my friends, it really did go up drastically. They were posting a whole bunch of different things that I honestly did not know that they would be posting. So I did have to lose some friends out of that.
Their insecurities, I think that some people are probably telling them on social media that they're fat or something. They might go on someone's social media and comment bad things about them.
I genuinely had to console a friend because she was having a mental breakdown over negative comments on a post she made. That instant gratification from someone liking our post, from someone commenting something nice, and the downside to that is that we place so much importance to this. When we don't get the response we're hoping for, we add extra stress onto ourselves that I see that affecting my peers.
So some really great words from our students. They seem to be, interestingly enough, especially that AJ at the end, very aware of some of the implications of social media. AJ actually mentioned, and we didn't use it in the interview, but that the post that his friend who had the mental breakdown was about her vacation. And I guess some individuals just responding nastily or negatively to where she went or what she was doing, but something so trivial that you wouldn't expect, anyone really would expect to receive this sort of negative response to. And Abigail, who is a 6th grader, really talked a lot about body image. And we tried to capture it in the interview, but she talked a lot about her friends feeling fat. Of course, when we talk with kids, we ask, about their friends in order to, make the conversation a little bit easier for them to get into, but a lot about being fat, a lot about the fact that they may feel fat because they post on social media and people may say things. So a lot of, what these studies are coming out with, we are seeing being echoed by our kids. And, that the fact that the social media has been this really, as Destiny said, the only way that they were communicating and people's, use just went through the roof. So I guess I'd love to talk a little bit about why social media has these effects on our kids. I guess a little bit about what we can do about what the right way to deal with social media is, but just first really understanding. And even when I was talking to these kids, I said, I was trying to give them examples, and it's everybody that social media does this to, right? It's not just teens. But Dr. Mirhom, if you could kind of expand a little bit on what we heard in the video.
Sure. And I start by saying we know that social media is one of those tools that can really go either way. It can be right, and for sure the answer can't be for us to say, well, okay, all right, all teens, delete your Instagram, get off TikTok, throw away your Snapchat, right? Because there's a part of this the same way as even the video game community, right? And Dr. Joseph can kind of speak to that even more. There's a part of this that can be a way that the promise of social media, the whatever CEO is trying to sell us, is that this connection that can happen. There's a part of that can be done with good boundaries. But what I've been really interested in seeing recently is the profoundly negative effects when we have no boundaries in social media and how different they can actually be with each app. For example, like we know now, Instagram has a way to sort of decimate your body image. It's an open secret, really, that each one of these algorithms are preying on these young people in a very specific way. TikTok, for example, the senior content strategist, I think, was on the news recently, and he was speaking to the fact that, yes, he was sort of caught in a line of questioning that if you feel down or depressed, the For You algorithm will feed you more videos about feeling down and depressed. And all of a sudden you find that your whole sort of For You page on TikTok is very depressing. Well, because it recognizes what you're into, it recognizing the emotion that you have, sometimes maybe as good as we can, and just gives you more and more of that content. So I think one part for us in terms of recognition and education, and we have to come to the teens in a way that we're not just these old people, get off my lawn, stop using social media is bad. But here's a way that, I love TikTok. I was on TikTok live last night. It's very engaging. Dr. Joseph is huge on all these social media platforms because because it can be a way that you can engage with teens in a special way with your patients, get questions answered. But the big thing is, like any good tool in your life, uncheck, it can ruin your life. And I've seen people in the office that have come and had, as one teen described in these videos, serious suicidal ideation because of a social media interaction. And that's not trivial, because social media has become the same. It mirrors our life, our social life, in the same way that you can have something in real life, something at school, someone bullies you or says something terrible about you, and the comments don't stop. When you were able to go home from school in the old days and you could disconnect from the bully. Now the bully can find you on 15 different platforms. So it's very real. So the risk there, the fear there is very real, but the possibility of sort of boundaries and within a proper context, social media can be enriching. So that can be a message that we can share with our young people too, is understand how each platform is coming for you. Okay, so when you know that it's either it's your self-esteem or your self-image, or recognizing your emotion and honing in on it. And when you're aware of that, you can see, well, there's different accounts that you can follow. There are people that you can have fill up your newsfeed with folks who are experts. There are many great speakers, and including our own panelists who are on these platforms. And the more you can hear from them, it could be a good, snippet in your newsfeed there. So I think that's the balance that we want to strike with our teens.
I like that. I like that idea. And you brought up an interesting point. One of our students said during the pandemic, that his parents didn't realize the effect of taking away his phone, right? And so if, he was in trouble or getting disciplined and they took away his phone, that all of a sudden, again, because of the pandemic and no school, no interaction, the isolation that he felt was just, traumatic. And that he just had no outlet to connect with friends. I know Carrie or Dr. Joseph, if either one of you could talk a little bit about, and I think Dr. Mirhom kind of addressed the idea of connection through social media, but in particular, why connection is so important for teenagers, right? Particularly this age group with their peers.
So when we light up the teenage brain and when we look at how it works, when teenagers experience social rejection, the same parts of their brain light up as if they were getting stabbed or shot or physically hurt. So their experience is very different than adults. So we have to validate that. Rejection hurts, right? And so I've seen this in my office where a parent is like, okay, my child is on social media, they're doom scrolling. At the same time, it's the only way that they can connect. What do I do? And so again, you gotta validate that there are certain populations that are going to be more vulnerable. And for those parents who haven't had that discussion, or those teachers, you really have to set up a diet, right? What is your social media diet? Is it a balanced diet? Are you spending as much time virtually as, in real life, doing something that keeps you physically engaged? And if you're able to balance that diet and have the teen buy into this agreement, then I find that the adolescents and the teens cope better, because yes, you have to validate they have an online presence. It may not be reflective of what's happening in reality. It still is powerful for them. It still provides a certain sense of identity. So you can't just eradicate that. However, provide that balance in real life. Zoom fatigue is real, and so is doom scrolling. So being on these platforms for hours at a time is not healthy. It's also not realistic to, completely remove them. So you got to balance that out.
I think it's also important to point out what parents and guardians can do. Like, what are the solutions here? So, obviously raising your kids with strong family values and staying involved is key, but parents also need to model what they want their students to do. So put the phone down, put the screens down, no phones at the dinner table, that type of thing. And then having these open and honest conversations with your kids as well. Because, I'm a mom, I'm on Instagram. I can see myself comparing myself to those perfect moms. I wish I had more time to craft with my kids, that kind of thing. Like, we do it ourselves. So we're seeing this in our teens, but as an adult, I can also speak from experience that happens sometimes. So parents really need to model that good behavior. It's really critical.
I would say one other element too, if I may, Amy, is that sometimes even getting into the nitty gritty of it with your team. Like, I've seen some parents where they'll say, all right, we can get on Instagram together. We can do a TikTok trend together. Let me see who you follow. Like, not in a way of policing your phone, which can go very wrong, but in a way of engagement. Like, I'm interested. Who are you into? Oh, you like this, this music artist, you like this, person or whatever, and a way to kind of get to know the person. And as you're doing that, you say, oh, well, I also kind of like this person. Why don't you follow this person? Or why don't you consider doing that? So one way to sort of balance it, I love what everybody's saying. And we can sort of look at not just the timing or how often we use the phones, but even how we practically use these applications. Because at the end of the day, one thing we have to realize is that, generally speaking, parents are just not aware of how these apps are working. Some of us maybe are on Instagram or whatever, but the vast majority of caregivers need a couple of tools. Okay, this is how I've actually walked through families about the difference of why Snapchat is different from Facebook, right? So you have to kind of, a couple of things to be aware of, and maybe it can be a way to engage more with your teen, which the more we can engage, the better.
Yeah, it's changing daily, right? Again, I think I mentioned earlier, I just heard about Discord, which I didn't know about. And one of our students was actively talking about how, unfortunately, in the hybrid setting, many students were just on Discord, talking to each other in the classroom on Discord, and then going and sitting in the groups of their Discord chat rooms, right? And then they're chatting in the Discord in person, but you can just imagine, the type of separation and bullying and leaving out that could come from, just even that type of work in a social media app. Well, thank you all for that. And I think, Carrie, you made a great point about self-modeling and making sure that we model for our kids the behavior that we want to see. And I also love the idea of the diet, right? Or the edit, what you choose to follow. One of the things a lot of our kids said, interestingly, was, it's, I think, particularly with Instagram or TikTok, was that they don't post, but they follow a lot of things, right? So they themselves are not opening themselves up to some of that rejection that Dr. Joseph called out, and the annihilation that can come with somebody giving you those negative feedback. But you then could still end up in doom scrolling or something of the sort, depending upon what you're searching for and what you're following. I'd like to switch a little bit and talk about other external influencers that are impacting our kids. So social media is obviously something that has been a heavy piece, but there's a lot of other influences that are taking a toll on our kids. And there's definitely the instability, and being a teenager is challenging in a stable environment itself. And we're hearing from our students that they're being impacted by the changing family dynamics, the caretaker loss that Dr. Mirhom brought up. There were a lot of changes during the pandemic. A lot of students took on extra jobs to help with family income. And, just we had one student who we spoke with who talked about how she contributes to the car, she contributes to the rent. And, obviously the ups and downs of the, employment and different families over the pandemic and just a lot of outside stressors. And I think they don't get talked about as much, per se as social media does. And we don't really shed the light on that. So Carrie, if you want to start, if you have any examples from kids that you work with, that's what some of those external factors look like. And then Dr. Joseph can kind of maybe give us some insight into why those have such a big effect on our kids.
Sure. So as you mentioned, Amy, the pandemic, it's caused a lot of changes in a family dynamic. Many of our teens are shouldering the burdens of both children and adults during this pandemic. So either parents lost jobs and it's forcing teens to work and contribute to the family income, or parents might be working non-traditional hours. So those students are taking on more parenting roles like in the evening hours, or it could be like a combination of both. So we're definitely seeing that, like at Propel, for example, we have a robust after school program that's open up to grades 12, but we're not seeing as much engagement with high school students because they have these part-time jobs that they really need to have so that they're contributing to that family income. So we're definitely seeing that here.
Yeah, I mean, these are very real stressors for some of our teens. And unfortunately, not everyone is equal across the board. And we know that certain demographics, particularly Black, Brown, Latinx, they're going to struggle more, and so we can't invalidate that experience. Again, that's why I say prevention is key. We know the groups that are going to be more vulnerable. And so that way we can support these groups. And, I think that we are going through a novel time where people are openly talking about mental health. We have celebrities talking about it. It's kind of like a thing now, right? At the same time, the people who are really struggling, they're not allowed to show that side of them because they have to be strong for their families. They have to work. They have to babysit. They have to do these other things that, take away from their identity as a student. And so, schools and communities can identify these more vulnerable groups that we're aware of because of previous pandemic psychiatry and really support these groups because their struggle is different and their struggle is very real.
Absolutely. And you offered me a fabulous transition again, Dr. Joseph. Our kids they're struggling right now. And I think, the idea that yes, mental health is out there and that people are talking about it a lot more, which is wonderful. But the question I think that comes up for me, and I think for everybody in school sometimes is who are they talking to? Right. And, we had actually a principal, I believe, or a counselor in Oklahoma, one of our Oklahoma schools who said, it's great that yes, we're talking about it more and that yes, it's more open, particularly in that community where it really has been repressed. But the question is, where do they go? Because there's, at least in that campus in particular, there's no one for them to turn to. So we actually asked our kids, which I'd love to play in a second, but we actually asked our kids, well, who are you going to for help? And who are you turning to?
So personally, I just don't like to talk about my stresses with other people because then I feel like a burden on others.
I don't really tell anyone if I'm stressed out or anything, or like if I have a lot of anxiety, because I don't want to they have more things to worry about than my stress, my anxiety. That's what's me. I have to work on that.
It's hard to find somebody that you can rely on.
And as far as counselors, I know that's what they're for. I know that's their job. And I know that their intention is to help me. But I just feel like they talk to a whole bunch of other kids all day. So I'm like, maybe at times they hear the same thing every day. They get the same advice out, but they never really understand what we're going through. So it's their job.
Say we talk to our parents, they're going to judge us. If we talk to a counselor, it's going to put a mark on our school record. And at the core of that, I think, is the fear that in some way, when dealing with our problems, we are alone. That is one of the core problems when it comes to teen mental health. We don't feel that there are people who are actively there for us.
This video actually always gets me the most. So, just hearing from them, just how, being able to articulate so much that they are having the pain, but they don't know where they go to, or just the idea of not wanting to be a burden on somebody. I don't, teens are a hard to reach audience, right? It's why HealthCorps does the work that they do. It's why it's so important that they have role models and mentors in their lives. And the pandemic has obviously, as we just talked about, raised the level of mental health issues and the need for them to go somewhere to talk to. And, as our school partner, Propel in Pittsburgh notes that pre-pandemic, 20% of children had mental wellness issues that, if not addressed at an early age, can impact every part of their life, including academic success, socialization skills, and the ability to meet both current and future challenges. So knowing that this is there and knowing that this is exacerbated, how do we help them? How, Carrie, I'm going to turn to you first. How can schools combat this pediatric mental health crisis? And how can we help school personnel, support them?
So first, I just love these videos. I love how honest these kids are. And it's so, you can tell how important it is to listen to kids. Like, we can really learn a lot by listening. But yes, I can speak for what we're doing at Propel schools. So just to give a little background on Propel, we are a K-12 network. We serve about 4,000 students from majority high poverty areas throughout Pittsburgh, Pennsylvania. And across our schools, 85% of our students qualify for free or reduced lunch, 86% are minority, and 19% have special needs. So in our school specifically, I would say that love really fuels achievement. Those student-teacher relationships, the staff and student relationships, they just mean so much. Building those relationships can create safe environments by building trust and allowing students to take risks and overcome challenges. And it's really important to get to know your students on a personal level, because those relationships are going to have long-lasting implications for not just their academic development, but their social development. The student is more likely to confide in that teacher. They're going to be more engaged in their learning. They're going to behave better in class and achieve at higher levels academically. So that's just one small but very large piece to this. And those teachers with the strong relationships, they're going to be the ones that will notice when something's off with a student, or when something's not right. So students won't be able to fall through the cracks, so to speak. With regard to mental health, Propel recognized the need for a more comprehensive wellness system in our schools. A few years ago, we were working with an external evaluator, and the findings showed that we had a need for more intensive services for our kiddos that were not responding to the positive behavior interventions that all students were receiving. So for example, it was recognized that these certain kiddos were they could benefit from psychoeducational small groups or outpatient therapy, but we knew that they were not accessing that in their communities. And for many of our students, and this is true today, mental health services that are provided in the schools are the ones that they're going to access. So this is how Propel Partners in Wellness was developed. We call it PPIW. I'm the project manager for PPIW, so I oversee this team of fantastic prevention specialists and student assistance program liaisons. And we've contracted with a community partner here in Pittsburgh, and the staff, I can't say enough about them. They're amazing. They are embedded in the schools. They are full-time in our schools, and they are linking families and students to either in-school or community interventions, community-based services, sometimes both. They're facilitating and co-facilitating small groups. They're providing consultation to staff about the Pennsylvania Student Assistance Program. And at the prevention level, they are delivering classroom lessons on social emotional learning topics. Something else that's really unique about this partnership is our PPIW staff are also providing professional development for our educators. That's key. So in addition to providing services for our students and families, they're providing professional development that's going to help our teachers and our staff succeed in their practice. So that's one way of providing support. Super, super important to listen to school personnel, especially during the pandemic now, because we're experiencing life in new ways. And as we've been talking throughout this whole call, we're seeing a lot of different shifts in behavior with our students. So we need to listen to our educators. What we've been doing as of late is we've been holding focus groups. We're sending out surveys, really listening to what our school personnel need. And I would also just want to point out, listening to students, it's super important. It's the most important thing that we can do, especially during this pandemic, is to listen, don't minimize their feelings, don't invalidate them. It's just hitting them in a much different way. And as someone mentioned earlier about, they're only in high school for 4 years. So if 2 of those years are being shifted and, they're missing out on traditional sports and maybe, they didn't have a musical that year and the things that our kids, it really brings them joy. They're just, you got to feel for them. They're really experiencing things in a different way. So we need to listen to our staff. We need to listen to our kids so that we can find the best ways to support them.
Yeah, thank you, Carrie. I mean, Propel is doing just such incredible work on that front, and really encompassing the community and bringing resources like HealthCorps into the classroom, where we're able to provide peer mentor support and teach mental health lessons and techs and tips and tools for kids to manage their stress and their anxiety. But I do want to just acknowledge that Propel is one incredible example, but many of our school partners and many of the schools across the country are suffering. They are significantly understaffed. They have teacher burnout that is just through the roof. And so you brought up that special teacher relationship, and some of the students actually also brought up special teacher relationships as being a place that we can go. But Dr. Joseph and Dr. Mirhom, what do all of us do, right? What collectively is the we in this society? The big part of, part of this conversation was awareness. We're all hearing about it. How do we normalize this discussion? How do we get support and access to our kids and support the schools that are, understaffed? The principal in Oklahoma, for example, who has a lunch aide covering classrooms because he has no teachers or substitutes.
I like how Carrie started off with love, right? And I'll take that a step further, right? It's trust. And again, these kids have been traumatized, and traumatized kids don't think, okay, someone did this. It must have been something I did. They blame themselves, they internalize, and then they don't share. And so when you trust a teacher, when you trust a program, when you trust, a school that has a culture of listening, active listening, right? Not just saying, oh, I know what you're feeling, but really listening and validating how they're feeling and what they're going through, and then allowing them to really vent and talk about what they're going through and have a space for that, a safe, maybe even a peer group for that, that goes a long way. And so, with trauma, we really have to meet these children where they are. And, programs like this support their values. They really ingrain and invest their values, as something that's important and something to be really recognized. And, also focusing on their vitals, like, are they getting enough nutrition? Are they feeding their brains? Are they really taking care of their bodies, and creating that vision for them? Because a lot of them have really lost, hope. They've become really resigned to, well, I don't really care. And that's where that suicidality comes from. When children don't have something to look forward to, something to give them purpose and to work forward to a greater good, they really don't have like a purpose. And so it's really important to have these type of things in school settings where the children spend the most of their day, right? Because by the time they're home, they're doing a million other things.
I agree there. And I would say, because this problem is so all-encompassing and so overwhelming, that old adage of, it takes a village to raise a child is all the more true in this situation. And for me, maybe the village, also like a sports analogy, it takes a team. And when we make one person of the team, teachers, for example, who are near and dear to my heart, my parents were teachers, and I'm seeing a level of burnout in teachers that I've never seen in my career, because we are often expecting them to be the one-man band or the one-woman band who's going to be the teacher, the student's counselor and confidant and friend and mentor and teacher, and tell you all the things that you missed in the last 2 years and now reteach you all of algebra all in one day. So this team approach, I think, is really key because, for example, part of the team that I think is critical that we should take off of teachers and take off of students as well is screening. There's one program that's happening in New Jersey starting next year where we're not going to be waiting for teens to come and say, hey, I think I'm depressed. We're going to ask them. We're going to screen them and say, we're going to ask you a couple of questions. And lo and behold, of course, we're going to find a gigantic number of people, because whenever we screen for mental health, we always find much more than we think we'd find. So this, I think, proactive, and as Dr. Joseph mentioned, the prevention, the proactive approach, where if the teens are telling us, I can't speak to my parent because they'll judge me, or I can't speak to this person because I'm afraid. Well, we should take that burden off of them. It should be something, an approach is a practical way. There are many, not very expensive ways to screen teens too. But then the second part of the team part, and this is something for us as mental health professionals, I sometimes feel the need to apologize to the general public as how hard it is to get in touch with us. I know finding someone like Dr. Joseph, for example, child psychiatrist of color, it's like hitting the lottery. It's almost impossible to be able to find folks like that. So access is the part, I think, of the team that we need to be able to emphasize in the school setting. We're going to screen you. We're going to set you up with access for someone in the school. And then we're going to support you, all of us together. The rest of the team has a different role to play too. There's a role that the parent can play that the psychiatrist can never play, right? And I think some things that I walk people through are these sort of 4 Ps, simple things to think about. One is pause. Just take some time, put your phone down, throw away the whatever else is happening. Just take a couple of minutes. We're going to pause. We're going to exhale. We're going to breathe. We're going to be present together. So another thing is presence. Whatever that presence is, we're going to present in your activity. We're going to be present in your feeling, present in your loss, present in whatever way that is important for you. I am here. And oftentimes as we think about our own childhood, we may not remember what people said to us. We may not remember what people did per se, but remember who was there and who wasn't. Remember who was absent and who was present, right? And as we're present, then we begin to process. We process whatever is happening around us. And this is a safe space that Dr. Joseph had explained here as well before, is the kid wants to feel safe. The teen wants to feel like this is somewhere where I can be me, I can be myself. And then lastly, to know that if there's a professional that's needed, that's kind of the last P there, is I have a limited role in my team. I love sort of define the roles of a team member, right? I know that there's something that I can do, and I can do it to the best of my ability in your life as your psychiatrist, for example, but I'm not going to take the place of your close friend. So, and I'm going to empower your close friend to say, this person's role in your life is as important as my role. I think I'm all fancy and I've got degrees and whatever. No, but this person's role in your life is critical, and I'm going to empower them and empower you to say, but none of us should be replacing one another. Sometimes when I speak with teens, and to your question earlier, who are they turning to? The video, they mentioned who they're not turning to. They're not turning to all these older folks sometimes, but they can turn to their friend. And sometimes one of the things that I'll teach teens is you don't feel the need to be the therapist for your friend. Don't feel the need to give all the advice possible. Your advice is fantastic, but you're there to listen and support and love, less so to give advice per se, I would say. So I think overall though, if we have this team approach, that we're all in this together, the team approach with the teachers, the team approach with the students, I think it can go a long way.
You brought up a lot of very wonderful points, particularly having access to a psychiatrist of color, should that be, something that, a kid needs, is definitely an issue that we know is a huge hurdle in communities of color primarily. And also, you actually answered one of the questions that came in from our audience about, about the new New Jersey screening. So I want to just call that out. That was a question from our audience about the access to depression screening in school and how effective we thought that it might be. Additionally, there is one other question that came in. I know we're running tight on time. But I did want to bring this one up because I appreciate it. And I think as we talk about the collective we, and we talked about self-modeling, one of the things that is happening is adults acting out. So how are adults contributing to the anxiety of our younger generations right now?
Well, we know that children mirror what they see at home, right? And so I think Carrie brought this up. You have to be, a model for the behavior that you want to see at home. And it goes for teachers and authority figures as well. And there's some interesting data that shows that every 50 years, the anger in society spikes, right? So for some way we can predict it, but I think in this case with the pandemic, the anger and the frustration are just at a tipping point, and we see it on the airplanes, we see it on viral posts and so forth. And so again, validation, right? Validate your anger. Start with yourself first. As an adult, you sometimes have to say, I am angry, I am anxious. And then you can do something about that before you start to instruct children. And you see this in schools, right? Some of the schools that I work with, the teachers will start the classroom day with, we're all going to take a deep breath. We're going to be mindful. We're going to take, collective, breaks so that we can decompress, and then we're going to move forward. And so I think that that's an excellent example of modeling, right? Validating your own anxiety, your own stress, and then doing something about it, allowing a space to vent and modeling that behavior for these teenagers. And that goes a long way. I think it's more effective than saying, you should do this, you should do that. If you model it, they will do it as well.
I think parents are sometimes scared and want to shield their kids from the world, but sometimes that can have the adverse effect where if you're not sharing enough, that's actually increasing the anxiety in your child. So if you had a bad day at work, talk about that, talk through how you got through that hurdle in your day so that the child can learn those coping mechanisms. Again, back to the modeling, life is not perfect. We don't want to paint that picture for our kids because we're just going to set them up for failure. Honestly, we just need to be honest with our kids, not putting any burden on their shoulders, of course, but having that fine balance, especially with teenagers.
I love that. I think, I think one of the things that Dr. Joseph and Carrie, you both brought up, but this idea of having the words, right? I was just actually reading a really great article about it the other day, that having the words to express how you're feeling is so important, right? To be able to utilize those feelings and access them. So being able to model and share as adults, I'm angry, I'm anxious, I'm stressed, and be able to articulate what that means for us is just so valuable. At HealthCorps, we do something called the icebreaker lesson, where we talk about, okay, well, what are the emotions I'm showing on the surface? And then what is underneath all of that, right? What are some of the things that I'm feeling that might make me act out or might make me be, act out on an airplane, right? As Dr. Joseph said, or yell at somebody, for no reason. Why may I be doing that? And how can I say, oh, I'm angry that the pandemic has done this, or I'm terrified, or I'm stressed, or right, all those words and trying to articulate that connection to an action. So before we end, I just would love to give each panelist the opportunity to share one key takeaway for everybody listening about how to help our students with the mental health crisis.
So I'll just speak from the school perspective. I think at the school level, collaboration with stakeholders is paramount. I know that at Propel, it might be a little unique, but we do have a lot of strength in our support team. I talked about my team of prevention specialists and student assistant program liaisons. We collaborate regularly with our professional school counselors and our scholar support specialists, our attendance specialists. It's really all hands on deck. And as Dr. Mirhom said, it takes a village, right? But on top of that, I think it's also important to build strong relationships with our partners. So partnering with HealthCorps this year has been beneficial for so many of our students and our staff. And our HealthCorps coordinator, Julia McAfee, she is delightful. She works so well with our young teens. And so by partnering with organizations such as HealthCorps, we're able to provide more unique experiences and health education to our kiddos who need it most. So we're really grateful for that.
I can go next if so yeah, I think that HealthCorps really reflects what I use every day in my practice. I went through it earlier. I call it the 5 V's to thriving, and it's prevention is key, right? There's no vaccine for this mental health epidemic. So the first V is validating. It's super important, and if you don't do it, teens will not listen because you're not listening to them. Venting is the second V, right? Allow them to have a space to talk about these feelings and feel safe doing so. And then values, what gave them purpose? What do they believe in? What is meaningful to them? Invest in those values. Vitals are, the basics, like, are they feeding their body and brains? Are they getting the movement they need? Are they getting the sleep? Are they taking the social media diets? And the last thing, I think HealthCorps does this, it's the vision, right? What are you looking forward to? There's got to be something that is happening that keeps you future oriented. So you're not suicidal. So you're not thinking about self-harm. So you have hope. And I think that organizations like this really do incorporate those 5 V's to thriving.
I love that. And I would just say, in the face of something that seems so overwhelming and so kind of unbelievable to tackle, like this mental health kind of pandemic, the one sort of parting thought that I want everyone who's kind of sees this to take away is that good treatment can be life-saving and life-giving. This does not have to be, we never thought, oh my goodness, we would never get a vaccine, for example, literally, to be able to save our lives from this vaccine, from this COVID thing. But the reality that I want people to remember is that we talk a lot about the problem of mental health, the pandemic, the challenges, but the truth is, every day in our office, Dr. Joseph and I see people's lives restored. The vast majority of people that I'm seeing day to day are stable. Things are fantastic. They were really, really tough at a point. I'm not saying that, there's a 1-second cure-all. What I'm saying is that there is real hope here. It's not just a fantasy, and there is real treatment, and our lives really can be sort of restored when we've got our team put together. So don't ever feel like what's around us is overwhelming and can't be changed. I want people to remember that the hope is real, the same way the struggle can be real too.
Thank you, Dr. Mirhom. I love that. I think you guys all touched on just such wonderful points. The idea that it takes a team, that all of us on this, on this call, listening to this panel, have a role to play to supporting our kids in campus. Whether I think, Carrie, you bring up this interesting idea that schools can adopt of maybe, team meetings that are pulling in from all the different avenues of a school, right, to just talk about students, discuss their needs. And Dr. Joseph, totally in line with HealthCorps and just the idea of really the whole student, right, the whole human, and all of those different aspects of making sure that we touch and provide our kids with those 5 V's, and really focus on the prevention side of it. So I just want to first off say thank you to all of our panelists. Really appreciate you giving us the time today and sharing your insight and your wisdom. I learned a lot. This is, just an issue that isn't going to disappear tomorrow, as we all know. It's being called to light, which is very important. And I hope at HealthCorps, we'll continue to have the conversation and continue to address it. But this is something that needs our attention now, as we talked about that short-term trauma and preventing that long-term trauma. So one of HealthCorps' 4 curriculum pillars is mental resilience. We've talked a bit about it today, and mental wellness has been a foundation of our programming since the organization's inception in 2003, believing that a strong mind and a strong body go hand in hand, to Dr. Joseph's comment about those vitals. And during the pandemic, we significantly increased our mental wellness offerings for students, faculty, and parents. Those resources can be found on our website at healthcorps.org, and very teen-specific tools can be found on our Instagram channel and TikTok channel, Teens Make Health Happen. Our goal is to help teens understand they have the power to positively take control of their health and positively influence the health of their broader community. So with that, we'll hear a little bit from our teens before we end.
Things that have been really helpful is the activity that we're learning now is this thing called Bust My Stress. And it was a pretty fun activity. And the thing that helped me the most was listening to music, because I love music and it helps me bust my stress.
I think that before we want to get anywhere, before we really start pushing to solve this problem, that we need to educate ourselves, and especially mental health.
So it's important to address these issues and take them seriously when they're still in their infancy, rather than when they grow into more damaging problems.
We talk about a lot. We talk about stress. We talk about our families. We talk about health. We talk about body maintenance. We talk about a lot, and programs like that, I think they really help. They help students be engaged. Like some of those kids in my class, I never thought they would even participate in stuff, and they do participate in her class. So yeah, I think that actually helps.
Thank you all again. This has been an incredible conversation, and I want to give a special thanks to our students who really informed so much of what we discussed today. We shared small snippets of their feedback today and the time that we got to spend with many of them, but they really did inform the conversation. And a big shout out also to our coordinators and our regional program managers who helped us connect with students on the ground and make sure that we were really telling the story that they were all hearing in their classrooms. To our panelists, your insight and expertise is truly invaluable. Thank you so much for giving us your time today. And thank you so much for being a partner of HealthCorps. We appreciate you day in, every day, and the support that you give us to help make sure that our program is reaching as many kids as possible. And thank you so much to everyone who spent their time to watch and to listen to the information we shared today. Our teens are in crisis, and your willingness to listen, learn, and take action will help to resolve the issue. And there is hope, as Dr. Mirhom mentioned. Finally, I'd be remiss if I didn't ask each of you for your continued support. So please share this conversation with friends, colleagues, and family. Help us raise awareness of the teen mental health crisis, the work that we do at HealthCorps, and the work that our partners are doing to address it every day. You can learn more about our work at healthcorps.org. And lastly, I wish all of you a happy holidays and a very healthy new year. Thank you so much.